Some hospitals are reporting an increase in pregnant women being admitted with coronavirus.
CBS's Tara Molina spoke with a woman who was 6.5 months pregnant and unvaccinated when she got sick, forcing her to spend 2 months in the hospital before giving birth.
Kentrice Anadumaka is enjoying every moment with her son CJ. After contracting COVID-19 at 6.5 months pregnant, she ended up in the ICU.
What was going through my mind was I pray to God that my husband and my mom could raise my son, because I don't think I'm going to make it out of here.
Kentrice had not been vaccinated.
I wanted to get the vaccine, but I wanted to see how it panned out a little bit more.
Nearly 76% of adults have received at least one dose of the COVID-19 vaccine, but only 25% of pregnant people. The CDC and other major medical groups have strengthened recommendations that pregnant people get vaccinated.
Pregnant people compared to non-pregnant people have an increased risk when they get SARS-CoV-2 infection of hospitalization, ICU admission, the need for mechanical ventilation, and they have a higher risk of dying.
Northwestern University's Dr. Emily Miller says recommendations were originally not stronger because pregnant patients were excluded from clinical trials.
Scientists around the country have been working tirelessly to fill those gaps, and we're at a point where the medical community really feel like we have the sufficient data to say that this is safe and that we recommend it.
Studies show vaccinated pregnant people can transfer antibodies to their newborns. Kentrice remained in the hospital to get oxygen support until CJ arrived, but was able to get her first shot before he was born.
I wanted him to have as much protection as possible.
CJ was almost a month early and is thriving.
I always said, if I make it out of here, I'm going to share my story, because people need to know that this thing is serious.
She hopes others get the message that getting vaccinated can keep families safe. Tara Molina, CBS News, Chicago.